Hi everyone, my name is Lucky and I'm a first year in the Professional Masters of Athletic Training program here at USC. Today I'm going to talk to you a little bit about patient-centered care, with step 1 being welcoming the patient, as well as using the patient's name to address them and ask them any pronouns that they would like to go by, as well as a preferred name. After you introduce yourself to the patient and they introduce themselves to you, you want to ensure the readiness and privacy. Make sure you're in a nice, safe setting, as well as a setting where the patient is comfortable. You also want to sit down in front of the patient and remove any barriers of communication. Something we talked about in class was not standing over the patient or hovering over them, but becoming eye level to ensure that line of communication. Our last step of step 1 is going to be to ensure comfort and put the patient at ease by creating a safe space for them to talk to you of any concerns.
Go.
Hi, my name is Zariel. I'm a professional athletic training student at the University of South Carolina, and I'm going to show you how to do step 1 of patient-centered care. So to be started, I'm going to get some hand sanitizer, and I'm going to do this as I interact with the patients. Hi, my name is Zariel. I'll be your athletic training student today. And can I get your name?
I'm Morgan.
Morgan. How are you today, Morgan?
I'm good. How are you?
Okay, is that the name you like to go by today?
Yes.
All right, and I go by she, her, hers. What are the pronouns you like to go by today?
This.
All right, and are you comfortable with me being your provider today? All right. And so,
For step 2 of patient-centered care, you're going to indicate the time available you have with the patient today. You're also going to establish what you would like to happen during the visit and obtain a list of all the issues that your patient wants to discuss, whether that be mental or physical. And lastly, you're going to summarize and finalize the agenda.
okay, Morgan. So I have about 10 minutes with you today. So the goal of this appointment, I would just try to get a good understanding of what's going on and then we can talk about it later at another appointment if that's okay with you.
Yeah, that's great.
All right, Morgan, can you tell me what you're trying to get out of this appointment?
Yeah. So this last week I was running and I tripped and fell in a pothole and my ankle swollen.
So you're telling me you were running, so it happened about a week ago and you were running and you tripped and fell into a pothole? Okay.
Yeah.
Sorry that happened, but we can try to see what's going on, okay?
That'd be great.
So for step 3 of patient-centered care, we want to start with open-ended questions and avoid asking yes or no questions. And we want to use non-focused skills such as silence and nonverbal encouragement to avoid undermining the patient during this process.
Go.
So Marie, you can tell me you have pain in your ankle, so I'm just going to ask you a couple questions if that's okay with you.
Yeah.
Do you have anything in your family medical history that I could know that might be related?
No.
Alright, do you have a past medical history with injuries? Alrighty. And then on the pain scale, 0 being no pain at all and 10 being worst pain imaginable, how would you rate your pain?
Probably like a 4.
Out of 4? Okay, can you describe the type of pain you're having?
Yeah, it's really stiff and then every time I step on it, it's just sharp shooting.
Sharp
pain.
and shooting?
Yeah.
Alright, and you said it was a 4. Okay, got you.
Step 4 of patient-centered care is focused on the patient and clinician interaction. So as a clinician, you want to make sure that you are actively listening, repeating back what the patient has said. Also request more information if the patient is being vague or broad, and also avoid using filler words like okay, cool, or great.
Alright, Morgan, so what I've gathered so far is that you were running and you tripped in the pothole, you hurt your ankle, and on a pain scale of 0 being no pain at all and 10 being worst pain imaginable, it is about a 4. Alright, and then you describe the pain as shooting and sharp. Okay, and then you said there's no previous injuries in this area. Alright.
Step 5 of the patient-centered care process is that you want to make sure that you're summarizing often, as well as checking the patient's accuracy based on what they're telling you. And then you want to transition a conversation from like one topic to another in order to gather more information about what's going on with the patient more than just their injury.
Okay, Morgan, so we're just going to change gears for a second because I gathered enough information about your pain. I just want to know some other things if that's okay with you. So how has this injury been impacting you mentally?
Well, my friends, they're the ones I was running with last week. They go running 2 to 3 times a week, and I haven't been able to go with them this week, so I'm just pretty bummed out.
Alright, I'm sorry to hear that, Morgan. So you haven't been able to run and been able to do any activities?
No, it's really been it's been acting up, so I haven't been able to walk, but I don't have a car, so I've just been hanging out at home.
You don't have a car, so that's been impacting you too. I'm sorry to hear that. And also, is there anything at home that's impacting your injury?
The stairs. I've been hanging out in the living room downstairs.
You have been in the living room downstairs. Do you have roommates, anything that can help you out?
I have one roommate, but she's on a study abroad.
I'm sorry to hear that. Alright, Morgan, thank you for sharing that information with me. And if you need any outside resources, you can please let me know and I'll try to direct you in the right place, okay?
Okay, thank you.
Alright, So Maria, I've gathered enough information, and then we can meet again and we can get started on the treatment plan. But it was nice meeting with you today.
Thank you, that'd be awesome.
All right.
That you were able to take away some valuable information about clinician and patient interaction.